this is our video conference is actually about fighting against the novel COVID-19, which is organized by the Presidency of Communications, and we will have 2 hours program today. And this is the agenda we would like to share with you right now. First of all, we will give the first floor to the Director of Communications, Dr. Fahrettin Aitun. He will actually give his opening speech. And right after this, Beijing, Seoul, and Rome ambassadors will take their floors. And they will talk about the global impacts of COVID-19 outbreak, and they will talk about their supports, the aids they've been provided in this scope, and the negotiations they have conducted with the different countries within the scope of fighting against COVID-19. And you will be announced the next events for the other countries who are involved in fighting against COVID-19. By the way, there's a simultaneous interpretation service. You can listen to the interpretation simultaneously through YouTube channel. I don't want to take much time of yours. I give the floor to Professor Dr. Fahrettin Aitun, the Director of Communications. The floor is yours, sir. Thank you so much. I give my best regards and salute to all from Istanbul at the beginning of my words. Today, unfortunately, we had bad news of attack of PKK against 5 civilians, and they were killed actually today. And this is very sad day, and this is actually the cruelty of PKK terrorist organization, and our country and our nation, of course, will keep fighting against terrorism even under those COVID-19 days. So, distinguished participants, I would like to say welcome to our event, which is called COVID-19, the experiences and international cooperation in fighting against a pandemic. We always put an emphasis on the responsibility of the individuals in fighting against this. And although the individuals are not exposed to the domestic movement restrictions, but every citizen, every individual should internalize all these restrictions and actions they are supposed to be taken in the light of their sense of responsibility for their family members. And of course, the Ministry of Health and the Education and other ministries spent huge effort in a meticulous way in fighting against COVID-19. And we feel the same responsibility, of course, and we organized this event in a virtual environment. We would like to thank our ambassadors, thanks to their support and proper orientation for us. They will actually share all actions and measures taken in their countries where they've been assigned as ambassadors of Turkey. And we will also have a chance to evaluate the effects of the actions and measures taken by these countries. And after the end of the outbreak, what kind of world will be settled? We will see a new world. After ending the outbreak, we will see a new world, it seems, and we will be living in a different world, it seems, and we have to get prepared for this new world order. With this event actually organized by our presidency, we just want to bring contributions as much as we can. 1.5 million have been affected by COVID-19, and the death tolls is about 900,000. So our country and the entire world are exposed to this problem. Our country is not far from this problem, of course, and the totally 322 and 668 people have been tested, and of whom 34,109 positively tested, and 725 citizens died of virus infection. And the recovery rate is about 1,600, which is a very positive improvement, and we cheer ourselves up with these figures, and we wish health to all patients. And at the same time, we would like to thank our healthcare staff working during all days and nights for the citizens, for the humanity, let's say. We are so grateful to them. And under the leadership of our president, many steps have been taken since 2002. And this is a very strong indicator and contribution to our actions we have taken for fighting against COVID-19. There are developed countries, we see their actions, and we have a strong health infrastructure, and we have strong actions, and we keep the health status of the citizens as higher as possible. And our president has ordered many restrictions. And when we look at 2002 and 2012, let's say 10-year period, we opened a new era in our healthcare system. Let's give some statistics. In 18 years, actually, we increased the number of the hospitals from 1,156 to 518, and you see the single patient room number here we reached by 90,000, and the number of beds also reached by 239,000, and this is about the intensive care room numbers, and we increased the number of the beds in ICUs, so it increased 33 times more. And since 2002, we have made many investments in the healthcare system, and we have enough number of healthcare staff. In 2002, it was about 91,000 the number of physicians, but it increased by 161,000 approximately. In 2002, again, the number of the nurses was about 72,000, and it reached by 198 and 570. And in 2002, again, the total number of the healthcare staff in 2020, it's more than 1 million, let's say. And when we compare the healthcare situation in Turkey with the developed countries, you can easily understand and you can appreciate the distance we covered in the healthcare system. And in the United States, 34.7. In Germany, 29.2. This is the number of the ICU beds per person. And in our country, actually, we covered a good distance. I believe we are not confined in a certain region in terms of the investments we covered. We, of course, try to reach all citizens and all regions in our country as much as possible. Distinguished participants, by all accounts, the world is now in a very historical transition point. Maybe this is this is one of a few threats we have confronted with throughout the history. There are macroeconomic developments, and I believe these issues also accelerated the rate of this threat. And after the Cold World War, a couple of new threats revealed, and the countries, economies, nations are getting integrated. They are in need to each other, of course. All the threats we experience right now have an important impact on that. And the virus, firstly spread in Iran and Italy. This is a very important fact that we have to focus on. And as of the early days of coronavirus infection, as Turkish Republic, we have very closely monitored this. We established a scientific committee at the beginning of January, and of course, our president personally moderates and governs this process, and this important effort actually stopped the virus in a certain extent, especially in comparing with the other countries. If we did not prepare our national strategy, the picture we will see right now could be worse. And before the virus reached to our lands, we prepared our plan. And after the outbreak, of course, what kind of transformations will come out? So we have to have strong projections for the future. This meeting will pave the way for this, we hope. And after this outbreak, which will be winner, who will win, who will lose, and the countries bringing contributions and solutions to the regional conflicts will take the advantage of this issue after the outbreak. And I believe the trade regime, what about the regimes, economic regimes, financial regimes, and other things we will see. So I believe our national solidarity and unity are two important pillars for our achievements, and our nation, just like in the past, in the Independence War period, in 15th of July, military coup attempt resistance, we will actually manage all these things in a successful way. And because of the poverty, oppression, and all these things which are imposed on the people, on the poor people, we have a responsibility to fight against all these things. And we initiated this national solidarity campaign. We are self-sufficient Turkey campaign. So our nation actually vested in a very spiritual way, strong way. So our state is a bridge between the citizens and the state itself. And we see some people who feel themselves disturbed, but 1,415,000,000 lira have been donated so far, and you see that we have also received millions of SMS aids, and we will be supporting 2.3 million family thanks to all these donations. There is no doubt that we will fight against this invisible enemy, just like in the past we did, thanks to the leadership of our president as well. And as the Turkish Republic, we have been spending huge effort to create the balance between unfair components, unfair things. So we always support all the countries, whoever are in need or in support. And our president had teleconferences with the presidents of UK and Germany and France. And our president actually is the first leader having these calls with these countries. And on 26th of March, again in the G20 extraordinary summit of leaders, our president reminded important issues there, and in all areas which have been affected negatively will be we have to take necessary measures for all these areas in a common way. So TRNC, China Republic, Spain, Italy, there are 30 countries, and they had some helps and aid supports from Turkey, and we also supported them. Okay, now we would like to thank Abdulkadir Emin Önen, our ambassador to Beijing, and Murat, Salim, Esenli, ambassador to Rome, and our ambassador Durmuş, Ersin, Erçin, ambassador to Seoul. I would like to thank all of them for being with us, and would like to thank Mr. Murat Yeşiltaş. Thanks to his moderation, and we will get very fruitful results, I believe, from this panel. I give the floor to all of you. Thank you so much for your participation.
We would like to thank you very much for this very important speech, opening horizons for us. We would like to say that it is a very good opportunity for us to listen to the experience of Turkey and the opportunities that have been put forward. We would like to thank the Director of Communications. Now we're going to listen to our ambassador to Beijing, Abdulkadir Emin Önen, and we will be talking about coronavirus, and we will be discussing this under 3 pillars. The first pillar, the first dimension of our discussions will be about South Korea, China, and Italy. We're going to have these 3 examples being discussed. Some have been good examples, some have been bad examples. So this is going to be the first dimension of discussion. Which country has made a mistake? Which country has done the things in the right way? In addition to that, in the second part of our discussion, we will be trying to understand the situation from the perspective of the relations between our country and those countries. In addition, as Mr. Fahrettin, the Director of Communications, has mentioned, we're going to see a different world in the aftermath of this crisis. In terms of economic situation, there might be some differences that we're going to encounter in the upcoming periods. Therefore, I would like to also discuss the future as the third dimension of this discussion. Mr. Abdulkadir Önen, His Excellency, Mr. Ambassador, what can you say about China? What can you say about Beijing? Because when it first appeared, we were the ones who were watching the situation. But right now, China is in the watching position. So this is an important indication of the track of the virus. So what has been done so far? Well, China has been quite a disputed actor. Well, there were some criticisms by the USA. We can say that they're still going on with regards to some of the issues. So this being the case, what is the situation in China? What is the experience of China? Thank you very much, Murat. At the outset, I would like to thank and greet Mr. Director of Communications, Mr. Fahrettin, the other ambassadors to other countries, and I would like to also greet with respect the audience listening to us, and I would like to also pay our condolences to our citizens who lost their lives in Diyarbakir today, and I would like to also hope for patience to their families. So we are at the 0 point of this outbreak. And I have actually designed my speech over these 3 pillars. First, what was the situation at the very beginning, what has been done by the country at the very outset of this outbreak, and what was the comparison between this country and the other countries, and what are the measures taken. And at the end, we will be also talking about the economic outlook in the upcoming future. In order to understand China in a better manner, I think we need to make use of figures. Figures will be an important indication with regards to the virus. I suppose this is going to help us better understand the situation. China is as big as a continent. We need to think of it from that perspective. We are talking about 1.4 billion population. The Hubei state has 60 million population. The capital is Wuhan, and including the surroundings, we are talking about a capital city of 15 million people. According to 2019 data, we are talking about a big economy. It is corresponding to 1/4 of Chinese economy. So if we are to look at these figures, we need to think about China as a continent and then classify the situation. For instance, we're talking about Italy, which has 60 million population, and Italy is almost has this at the same population level when compared with Wuhan state. And I would like to share with you the number of cases. We are talking about 83,071 cases in Hubei. The total is 67,000. So we're talking about 83,000 cases all around China, and 67,000 of them are in Hubei. And the number of deaths, 3,340 people lost their lives in China, and Hubei, we are talking about 3,112 people who lost their lives. So this is these figures are important for us to come up with the right diagnosis. These numbers show us that this place where the outbreak started is as big as a continent, and this place was taken under a total quarantine after the start of it. So on the 23rd of December, the first case was diagnosed, and on the 31st of December, this first case was reported to WHO. On 9th of January, we have the first death, and the number of cases increased to 5,000, and then it spread to the rest of China. This wet market first was quarantined, closed down, and on the 23rd of January, first Wuhan, and then on the 24th of January, the Hubei, the whole state, is closed down, which means all the railway and road network were closed. And also there were restrictions on internal movement. There was a ban on internal movement too within the state. So a total quarantine was initiated. Therefore, these dates are quite important. This was also among the questions that were raised to me. Maybe I am also answering those questions. In the meantime, while I'm making my speech, WHO, World Health Organization, was also lagging behind. They were actually lagging behind in the following with regards to the crisis. For instance, they were not talking about a risk of a pandemic, and they were saying that this was not an obstacle in front of travel or trade. However, all transport was stopped at that day when the declaration from the WHO came. So if this was the case for the whole world, I am sure that we could have prevented that high level of spread all around the globe. Very serious measures have been taken in Wuhan, in the other states of China as well, and there were strict obedience to all those measures, because you know there was this SARS crisis which happened in 2002, so we're talking about a very serious experience. So first of all, it was not possible to name the virus. WHO was not able to understand that this was going to become a bigger pandemic. That is why the measures, if you have to talk about the 13th of December when the first case was diagnosed, well, this became an outbreak in a very short time. There were several different measures taken in different countries and in our country as well. It is not going to be correct, of course, to list all those measures, but I can talk about most significant ones. For instance, in the blocks of flats, the entrance was under control, so everybody had to use their identity cards in order to enter those blocks of flats. For instance, you're not able to go as a guest to another person's house. You need to only go to your house. So this is still the case in China. There is the online delivery, for instance. You receive online delivery by courier. It comes to the door, however, they're not able to enter the blocks of flats. You need to go out, take it yourself. Likewise, starting from the very first day, the measure of making wearing masks obligatory was taken. For instance, the taxi drivers are not able to take any customers on the first seat, and there was an isolation between the taxi drivers and the customers sitting in the back. In addition to that, all the infrastructure activities were seized. In addition to that, everybody who were traveling to China were tested. At the very beginning, there was no such tests. However, in the upcoming in the period that followed the first cases, a testing period started, and all the people, for instance, people who were living abroad, they were asked not to come, and the Beijing capital, for instance, was closed down to flights. All the flights were stopped, and the capital, for instance, was closed to the entrance of other people. And if there are, for instance, people who have to go to work, the number of people who can enter those buildings were also restricted. If we are talking about a 50 square meter of a working place, the number of people who were supposed to work there were also centered. And there is also this WeChat application. The embassies, for instance, came together in order to have a group. We have been able to reach people who our citizens who are living in those regions. Well, first of all, of course, there was a misinformation process because there was the crisis was very new, and that is why we added our citizens on such groups, and we also made our warnings to them. They were able to reach us and ask questions. As you know, there are citizens who are living in Wuhan, and there was a very good operation conducted, and we took those citizens to Turkey. 6 people from Azerbaijan, 3 people from Georgia, and 1 person from Albania were also taken from Wuhan by the operation. So right now, as of today, in Hubei, we are talking about quarantine conditions being eased. It is not totally lifted. Sometimes it is misinterpreted in press saying that all the restrictions have been uplifted. However, it is not the case. However, we can say that quarantine conditions have been eased and transportation started again. For the last 10 days, we do not have any China-induced case, and we do not have any deaths in the last 2-3 days. So if we are to think about all these conditions, at one point we can say that this has begun to be taken under control, and the quarantine conditions are also being eased in some other places. However, what is the situation in Beijing? If you're going to ask this, I can say that people are still cautious. They're taking their precautions, and they prefer to stay at home. With regards to the economy, I can also say a few things. We are talking about 90% of people in agriculture going back to work, and 75% in service sector resumed their work. In small and medium-sized enterprises, we are talking about 70% who started to work again. This is, of course, in the rest of the country. However, in Hubei, the relevant rates are around 30%. So we can summarize it as follows. The most important thing is that people obeyed the measures very strictly. And in our country, for instance, the relevant measures have been taken at a very timely manner. However, I can say that if the obedience level was that strict to 15 days ago, if the Turkish numbers would not even have reached that state. So for now, I will be closing my speech and then leaving the floor to moderator, and then I will be talking in the next round. Thank you very much. Thank you. We can say that there is a more positive outlook for China. Now I would like to go back to Rome. Murat, our ambassador to Rome, Murat, Salim, Esenli. So after China, the second center of outbreak became Italy. Actually, it also changed the center and became the epicenter of the crisis. And if we are to look at the last 2 days, we can see we have some relatively good news. However, in Italy, still the situation is quite severe. What happened in Italy? And what is the current situation in Italy right now? What is the outlook for Italy?
Thank you very much for giving me this opportunity. I would like to thank the Presidency of Communications for organizing such a distinguished event. Before starting my remarks, I condemn the latest attack of PKK, and I feel my condolences to 5 citizens killed by the attack of PKK, and I give also my condolences to their families. It's a very tough process, and as Mr. Director Fahrettin Aitun mentioned, we've been actually spending huge effort for fighting against the COVID-19, and I give my best regards to the healthcare staff because they are intensively fighting in the front. Okay, let me give you some brief information about Italy. The number of the case is 94,674. When we compare it with the last increase, it's about 33%, and the rate of mortality is about the number of the death 17,000, and in comparing with the previous day, 5% decline we see here, which is good news from us, from our side, and approximately 6.81% we see an increase in the cases. And when we look at the past again, when the first day, 13th of December, the first day of the outbreak in China actually was detected, and everyone actually in Italy thought that this virus would not come to Italy. But you know, when we look at the globalness level, let's say, we are in, it's very different. In the last decade, maybe we covered very long distance, and it was a mistake in estimations. You know, it was a global mistake in calculations and estimations. Okay, the crisis came out in Wuhan, but the information flow from Wuhan to Italy was also difficult. You know, it was very difficult to detect the difference between COVID-19 and the seasonal influenza. And you know, in the following period, they started to handle, they tried to handle with this process, and we also heard some social reactions as well, because Italians are also warm people, so at the first phase, actually, they showed a reaction against these strict measures taken by China. The outbreak firstly emerged in Lombardia region, and this social reaction paved the way for increasing the cases in Lombardia especially, but Lombardia also has the number of high recoveries, maybe highest numbers in recovery. And if in terms of Turkey, it's very critical, and it's a great pleasure for us to see that strict measures have been taken. And these tricks are very important factors in decreasing the cases, the number of cases, and that tolls, of course. The people need to go to the hospitals because of different needs, different health problems, not just because of COVID-19 suspects or symptoms. So it was very important matter to separate the hospitals dealing with COVID-19 and with the other infections, with the other health problems. At the first phase, again, there were some hesitations in wearing masks, and we had also some problems to find masks as well. And Turkey also sent masks to Italy. 100,000 is the number we need. It's the number of the masks we need daily, and we did our best to disseminate the masks. And there are now that we see the Italians actually obey the rules, obey the restrictions, and the police check the vehicles, passenger cars, etc. If they cannot give necessary certificates or documents, they are fined, of course. So maybe 300,000 is the amount of some fines which are imposed to the violators, because there are very tough problems we may confront with in a daily basis. And the Italian government and healthcare sector has also strong effort for developing a vaccine, because this is for the sake of whole mankind, which no matter what country develops this vaccine, actually this is common benefits. Okay, what did we do as embassy of Turkey in Italy? First of all, we concentrated on our students studying in Italy temporarily, and the state of emergency actually declared. And we have some students, the minors actually, coming to Italy through AFC scholars, and then we sent them to Turkey, and as of 21st of March, after having instruction from our president, we started to transfer our Turkish students studying in Italy, because it was not that easy, because restrictions and measures have been intensified in that time. Because some of the students actually were studying in towns and in some districts maybe 1 hour or 2 hours away from the downtown. So it was our priority to transfer them to the downtown and to the airport, to send them to Turkey. And we also transferred some other students studying in different cities to Milan and to Rome, and then we transferred them to Turkey. Another issue was about our students coming to Italy with temporary visa. They had, of course, many concerns because they had to stay in Italy. Maybe their visa time expired, their staying period expired, and they had some concerns if they would be punished or come across with different problems in the future in their applications to visa. But of course, we contacted with the officials, and it was good news for us. Until 20 of June, you feel yourself comfortable, although your stay is expired, documents are expired, there will be you will not have any problems with that. So it was very good news from our side. It's not possible to say that the problems are over. You know, Turkey and Italy are two integrated economies. 20 billion euro is maybe is our projection, investment projection. Actually, we closely reached to that, but now President actually put $30 billion projection, investment projection. But because of this problem, you know, we have to recorrect these projections, unfortunately. And the shipping companies, Italy is a hub for the shipping companies as well. And of course, we spent huge effort for them to come back to Turkey. We get cooperation with the chief consulate of Marsilya and with Milan as well, and 16 drivers have been moved to Marsilya from Trieste and then to Turkey. This is good news, good developments for us, nice improvements. We keep informed our students about all these things we achieved. There are some reflections to the relevant sectors. If you allow me, I give you detailed information in the second round. Yes, thank you so much. It was it's very nice to hear from you. And then we come back. We give the floor to Seoul. Let's listen to the developments in South Korea. Seoul, South Korea is a very good example, very successful example in terms of its policies, health policies, measures, actions, etc. So, what did you do, and how did you contain this disease, and what is the current situation? Thank you.
Mr. Director, distinguished ambassadors, I would like to greet you all with respect from Seoul. Well, it is quite clear when we listen to the speeches. We are talking about the largest crisis of the 21st century, and many countries have been unsuccessful in terms of responding to this crisis, to this outbreak, in a timely manner. We have understood that many countries were not ready, were not prepared. WHO, the World Health Organization, hasn't been able to provide the guidance, relevant guidance, necessary guidance to the other countries, and the declaration of pandemic was quite delayed, belated. South Korea followed a different lead. It did not follow China or the UK, which followed herd immunity, but it focused on, South Korea focused on the lessons it took in SARS and MERS crisis and act prepared against the crisis. When the first case was carried to South Korea, a comprehensive strategy was taken on board. So a Christian community, unfortunately, extremist community, tried to spread this disease, and this was followed by very strict measures taken. What was done? First and foremost, President Moon ordered the medical companies to produce testing kits. These pharmaceutical companies already started to work against any potential outbreak to produce drugs as well as the medical devices to be used in this type of a crisis right after SARS and MERS. Widespread testing is very much important, has been very efficient in terms of the response by the South Korea. If we are to look at today, we can say that we're talking about more than 20,000 tests daily and more than 100,000 people have been tested, South Korea or not. Independent of the symptoms, people are being tested freely while they're walking out on the street, while they're taking a public transport vehicle, while they are going to their work. And these tests kits are giving up the result in 1.5 hours, and if there is any positive result, they are taken directly to the hospital. So anybody who have contacted such people are also identified, and the relevant information about those people are sent to all the people living in Korea through cell phones minute by minute on real time. So it is not just information with regards to the patient, also people who are tracing, who have contact, because the relevant contact has been also traced. So those people are also taken under control, and the relevant places have been isolated, and the disinfection measures have been taken. In addition to that, well, the hospitals are also informed under such circumstances so that the relevant measures are taken. The process is carried out under full transparency, and this is actually the most important strength of this process, because there is information sharing, mass messaging in order to warn them against the situation. In addition, when we are to look at the measures taken in the schools, well, the schools were closed at the very first day at all levels of education. These students are right now on vacation, but still they are following online courses. In addition to that, all the social cultural activities all around the country have been cancelled, including weddings. And in addition to that, worship places, well, collective worship is, of course, strictly discouraged. However, this is a problem because in churches there are still people who are participating in Sunday prayers, and this is creating a fear among the community with regards to a rebound of the outbreak. The measures are taken in order to oblige people to wear masks. In addition to that, in public areas, there are disinfectants which are provided, and in the entrance of the public institutions, still people are measuring their fevers, and if they have fever over 37.5 centigrade degrees, then they are not allowed to enter. In addition to that, the virus control officials are all around the operation and around the country. First of all, the restrictions and prohibitions were implemented on the people who were coming from China to South Korea. This is now extended to everybody who is coming from abroad to South Korea. There is a quarantine period of 14 days. And if they are not obliging with this, we are talking about $8,000 of a fine, and it is also possible to deport if they are foreigners. When it comes to members of the diplomacy, there is an application, mobile application, which is uploaded on the phones, and they are able to follow their symptoms for 14 days in order to ensure self-diagnosis. Maybe it is due to the Confucius culture, obedience and respect to the authority, and there is also this respect among the scientists and to the medical people. So therefore, we can say that this quarantine and isolation measures are being implemented in a very strict manner. In addition to that, we are talking about internet delivery services, which are delivering to houses. All the supermarkets are able to bring the needs to the houses of the people. So this is an important contribution in this process. When following this result, we are talking about the restrictions by more than 100 countries, which was not favored at the very beginning, of course. And this prevented the infected cases arriving to South Korea. The Turkish Airlines, for instance, stopped the flights on the 1st of March, and this was followed by the other airlines, and it is forbidden. The flights are prohibited right now from and to 150 countries. As of today, we can say that South Korea is trying to leave this crisis behind, and as a byproduct of this process, South Korea has begun to sell all the medical kits and medical tools that are being produced in the country. So this is an economic input in the country as well. In addition to that, if you are to look at the last week, there is a process of normalization steps being taken in order to get ready for the aftermath of the crisis. Samsung, LG, and other such companies are telling their employees to stop working from home, stop home office work, and they have started to call them to come to the offices. And as of May, the Korea Airlines will start its flight. So we started to hear such news. So this means normalization process is also starting a kind of to create actually a feeling that this outbreak will not last too long. On the other hand, we can say that South Korean economy has been deeply infected because we are talking about a global cost which is unprecedented, and IMF for the first time said that we're going to see such an unprecedented crisis since its establishment. We are talking about $144 billion of three, including today's package, 4 in total packages have been introduced. It is focusing on social security measures, supporting small and medium-sized enterprises, giving support, financial aid to the people who are in need, who have low income. So several measures have been taken. In addition to that, there are some measures with regards to financial market in forex prices, crisis management, foreign currency management and supervision measures, and some prohibitions for 6 months with regards to changing the parity of the short-term foreign currency. Several measures have been taken in the financial market, and we can say that there has been interest at the largest interest decrease for the first time in the South Korean banks, and the government pledged 80% of the wages paid to the employees. When it comes to the people in need and small and medium-sized enterprises, several credits and loans are pledged by the government again, even though the WHO was quite belated and delayed in terms of declaring that this is a pandemic. An emergency has been declared, state of emergency was declared by the president in South Korea at the very outset of this outbreak, and the relevant places have been declared as the places of regions of disaster, and the relevant emergency packages were sent to those states and cities. Especially $1,000 were given to the people who are in need, and also to the medium income families, $328 were provided. Several activities have been carried out, and we know that we have introduced a campaign, a national solidarity campaign in Turkey too. We are self-sufficient Turkey. So this, the 30% of the wages of the government will also be donated to the campaign for 4 months in South Korea. In addition to that, all the health services are being provided for free. The students and foreigners residing in South Korea are also very comfortable because they're able to get free treatment in cases of COVID-19. We are talking about 10,384 diagnosed cases. The death toll is around 200, and we are talking about more than 500,000 people tested. The second center right after China at the very beginning was South Korea, but right now South Korea is ranking 17 among the countries where we have COVID-19 outbreak. And since the very beginning, our embassy has been also taking this situation very seriously. We have been giving information to our citizens in terms of the situation. We are giving them information in terms of access, under emergency cases. We have 1,100 citizens living in South Korea. We have not evacuated them. Well, until last week, we can say that this has not been a place where transportation was seized. Up until last week, for instance, Qatar Airlines were still flying to South Korea. So it was not a problem to evacuate such citizens. Well, if you like, we can say that in the upcoming period, in order to prevent such potential outbreak, and the impacts upon economy could be discussed in the other round, in the second round. Thank you very much, Mr. Ambassador. South Korea is actually is an important example, is a very good example, and the South Korea is actually seeing better days. And in the upcoming period, as Mr. Ambassador mentioned, there will be a slow, though small, and normalization process which will be beginning in South Korea. So if you like, right now, we can talk about the dimension of international cooperation with regards to the fight against pandemic. This part is quite as important because our health minister, Fahrettin, mentioned a very important item at the very beginning, which was also repeated several times by our president, Recep Tayyip Erdogan. This is a global pandemic, it is a global issue, whereas the fight is national. Despite the hurdles at the very beginning, international cooperation has been understood to be very important, very critical, especially in the second phase of the outbreak. When it reached Europe, we saw that there was an increase in international aid, which is also the case for Turkey, because Turkey also provided support and aid to more than 30 countries. This is, of course, not just about just preventing the results of this outbreak, but also to prevent the damages or alleviate the situation. So I would like to go back to our ambassador to Beijing in terms of international cooperation, bilateral relations. What is the situation between Turkey and China? What can we talk about for the last 2-3 months?
Thank you so much. there are important cooperation areas which we have previously done. Turkey is the second country sending aids to China. We have military shipping aircraft called Koca Yusuf, and it actually converted into an hospital shipping. And we actually became the second country, and we also sent other kind of aids. So we are maybe the first or the second country helping China, and the public opinion and the private sector of China appreciated this aids so much. First of all, we have to say that this is maybe the biggest. This is the biggest threat and the problem in the last 100 years, in the last century. It's very critical issue, and we have to take this issue up in a very critical level. And when we look at the early actions and measures, we closely understand that Turkey has taken all the necessary measures in a very early phase, while China maybe Turkey established the scientific committee when we heard the first case in China. So it's very critical step. It's very significant action we have taken. You know, this is a common problem. This is a global and international problem. So the measures should be intercomplementary, and they should support each other. So you cannot isolate yourself just to secure yourself. If everyone is secured, you can only be secured in this way. So this is very important aspect that we have to understand, and the countries should come to an agreement, should come to a consensus about the urgent measures which have to be taken. And I don't think that's right attitude if we compare the countries, because every country has peculiarities, has unique systems, infrastructures, etc. The characteristics of the communities are different, so you cannot compare one country with another, and this is not right attitude. I think our ambassador to Rome can also approve this. You know, there are the mortality is so high, daily mortality rates are so high, but that's not because of COVID-19. That's also because of lack of infrastructure of healthcare system in Italy, and lack of some health services as well. And when we look at Spain again, the figures are getting so fast, getting increased fastly. So elderly people unfortunately died of lack of health services, and the 14-day quarantine period is important, and some have been locked down in some facilities, but unfortunately they had to pay all expenses of lockdown. So when we look at the states, again, they have a problem with their healthcare system, and the coordination between the local administrations and central government is getting late. So the healthcare services, especially for COVID-19, are so expensive. So every country has different policies, let's say. When we look at Turkey do not charge any healthcare services, any treatment, and for anyone who was confined in quarantine. And Turkey doesn't charge any transfer, any referral. And when you look at the practice in Wuhan, for example, they sent aircrafts, but they charged the tickets, flight tickets, and if someone doesn't have any money, so he's not transferred. So for the homeless people, for example, they host in the accommodation or guest houses of the public institutions. So we realize that all these services are provided free of charge. If someone asks the definition of being a social state, actually Turkey is maybe the best example for that. Okay, Turkey is doing its best, and Turkey is the single country in terms of disseminating the services to all citizens in an equal basis. And social solidarity is a very important indicator. I want to draw your attention to a couple of issues here. Minister of Foreign Affairs was in the heart, in the middle of managing a crisis. Maybe we don't have so many citizens in China, but all the foreign affairs staff, all the consulars, ambassadors, and the staff of foreign affairs have been exposed to thousands of requests from our citizens, and they responded to their requests properly and effectively. And on the other hand, all the daily needs and procedures in the consulates are going on. And during 7/24, all the services have been provided to our citizens in different countries. It's a very important issue as well. And when we look at our relations with China, this is also the matter of accumulation of knowledge and experiences. Our scientists shared their knowledge with the scientists in China, and vice versa. And what kind of techniques and what kind of measures have been taken in China. They shared all these things with our experts, physicians, and the China is now working on vaccine development. And Favipiravir, this is originating from Japan, but we sent it to Turkey right now. And in terms of supply of some medical stuff, we are in cooperation with China. And finally, I want to say that in terms of the cooperation between two countries, I believe the businessmen come together to exchange their views. There may be some challenges in internet environments. We should not lose our connections. We should be able to exchange our views, because the problem is common. Remedies and solutions are also common, so we have to share all these things with the world. That's actually all for the second round. Thank you. Okay, what could be your answer about Rome? Please answer the questions shortly, one by one, and maybe we can focus on the next discussions, and then we have to wrap up actually. So I give the floor to you. Thank you. Yes, Professor. After the crisis has broken out, our president called the Italian Prime Minister Conte, and he said that he said that, okay, we will evaluate your request for some medical stuff positively, and in this scope actually Turkey sent aids in 1st of April, and before that we also sent to Italian Red Crescent as well. We helped them, and we also contacted with Italian foreign minister on different occasions and for different cooperation areas. They had some phone calls in the previous weeks, and Turkey has taken all necessary actions and measures on time, so it is very appreciated effort by Italy, and Turkey has also sent many aids to Italy, and this is also another appreciated movement. In Rai TV or in some other mainstream media press in Italy, all these movements have been appreciated. It's a very important pride. It's a pride for our country, for Turkey, and it's very strong indicator for collaboration and cooperation. As Ambassador mentioned, this issue is so big, and we cannot fix this issue individually, so it requires a common work. Okay, we should also focus on new cooperation areas. When Turkey and Italy act together, they can cover important distances in the healthcare system as well. Production of masks or antibody developments or production of ventilators. It may cover a wide range of cooperation areas. And while doing all these things, of course, cooperation is extremely critical. Okay, we are fighting against COVID-19 on one hand, but on the other hand, there are important biases, prejudices in the European side against Turkey, unfortunately. But we give a good response to European countries by all these movements and actions and measures we have taken as Turkey. It's a very important model. It's important practice for the European countries, I think. Use of social media is important from our side as well, because it's important to inform Turkish citizens in Italy. And of course, it's important to make a link, make a tie with their families living in Turkey. So now we try to support our citizens staying in Italy. We support them mentally, spiritually, psychologically. Okay, Italy has serious losses. Maybe 10% of GNP is from tourism now, but it's about more than 120 billion. In manufacturing and textile sectors, the loss is about 156 million euro. So all these things require the government to take severe actions. For Italy, under the title of Core Italia treatment, 350 billion euro was the amount of treatment budget, but of course you cannot see the end. It's very deep crisis. And we need another package. The second pack is about 400 income. I believe you have to support the citizens in they calm down. The panic is almost over. In brief, I can say that cash flow plays vital role in Italy, and in terms of the supply of chain, you have to be able to maintain this chain of supply, let's say. It's also critical for Italy. So in terms of the cooperations between Italy and Turkey, I believe we covered good distance. We had nice taps. That's all for the time being for this second round. I can answer your questions for the third round. Thank you so much.
Thank you very much, Mr. Ambassador. So, our ambassador to Seoul, what would you say, Mr. Erçin? Erçin, in terms of international collaboration and cooperation and the bilateral relations between Turkey and Korea? I can also say that the economy of South Korea has also been deeply impacted, influenced. Well, there were some preparation, of course, there was some preparation and measures. However, they were not expecting that level of isolation. Korea became kind of an island right after the stop of flights by 130 countries, an isolated island in the globe. Samsung, LG, these big family companies have made significant losses in the first quarter, as it is the case for the other airlines. We are talking about 9 airline companies, which also had a lot of difficulties in South Korea. So there is an economic stagnation which has been hitting South Korea too. If I am to touch upon the bilateral relations between Turkey and South Korea, first, of course, stopping all the flights mutually is an important impact with regards to the economic relations, because Turkey is an important economic partner and commercial partner to South Korea. In addition to that, there was the invitation by our president, and there was this visit which was actually supposed to be carried out by the President Moon. However, this is, of course, has been, well, postponed. In addition to that, for a long time, there was the Joint Economic Commission meetings, which haven't been able to organized, which we haven't been organized for a long time, but this is also postponed. And in the upcoming period, I can say that when we leave this crisis behind, when the difficult times are behind, I am sure that we will have a better outlook when it comes to the mutual relations, bilateral relations between Turkey and South Korea, by taking lessons out of this process. I have mentioned this before, actually, in the previous rounds, taking lessons out of the previous outbreaks. South Korea was quite prepared and a lot of medical kits and medical products are now being marketed to other countries. So Turkey, for instance, is able to purchase respiration ventilators from South Korea. In addition to that, there is this drug, a pharmaceutical, which is used against malaria, which is also used right now under cold conditions. Hydrochloroquine is right now also being provided by the companies. Well, we will be providing it from these companies here. We are right now in close contact and communication with such companies in South Korea. In the aftermath of this crisis, in the upcoming period, in the upcoming years, we might also encounter other potential crises and outbreaks, and in order to be prepared, in order to increase our level of preparedness, I think there will be close cooperation with South Korea. In addition, we do have a digital infrastructure which is quite well in South Korea, so this has been able to help us to trace well the people around the patients, people who are in contact with the patients, and right now we are talking about electronic bracelets, which is right now being discussed on the agenda in order to trace well. Of course, there might be some implications of it when it comes to human rights and the privacy issues. This is right now being discussed. However, this might also be the case, and another measure as such could be taken in the upcoming future. And maybe we are going to discuss this as a response to the third question: what is going to be the aftermath of COVID-19? We're talking about the new world order. So, in that new world order, are we going to have these huge lessons implemented? So, I think in line with those messages, in line with those lessons, I suppose there will be a lot of opportunity, massive opportunities to be taken in order to bring the cooperation level between the two countries to a further level. As it is expected, if we can ensure normalization in the country, maybe we can arrange the expected visit by President Moon to Turkey in autumn, maybe, and of course, this is going to be contributing positively in economic, in social, in commercial relations between the two countries. There will be positive repercussions, I suppose. Thank you. Thank you very much, Mr. Ambassador. And your last point is, of course, quite critical. Maybe we can give you each 2 minutes. Well, of course, it is not easy to portray the situation in just 2 minutes. However, we do have limited time, and I will be giving you each 2 minutes to talk about where Mr. Ersin left the discussion. So, when is this crisis going to be finished? What is going to be happening in the aftermath of this crisis? Well, of course, we're going to have an inventory of what has been done. We're going to have a stock taking and what kind of a world is going to be expecting us right after this crisis. We are talking about, for instance, individual freedoms as mentioned by our ambassador, and rearranging of our daily lives and reshaping the global powers. So, first and foremost, I would like to give the floor to our ambassador to Beijing, because China is going to be in the center again of such discussions too. There will be a new type of fight, a new type of international relations platform, I suppose. So, His Excellency, Mr. Ambassador, what would you say? What is the perspective from China? Or if you are to take maybe China in the center of this question, what is going to be expected? Well, actually, this is kind of the $1,000,000 question, like asking the secret of the universe. Well, how is it going to be finished? When it's going to be finished? And how is the situation going to be evolved? Well, these are all quite vague issues, and we can see that the economic crisis is actually getting larger in the economical area, because as you know, economies do not favor uncertainties. Even in very small scale situations, economies have been fighting against such uncertainty. So it is very difficult right now to answer such questions from any country, from the perspective of any country. If you are to look at the first figures of the first quarter, there is this economic slowdown, which is leading to a narrowing down of the economy, which is quite significant level. There is the international rating agencies are making, for instance, assumptions between -4 to -10. So we are talking about very big implications. So what is the situation around the world? Maybe we can have a look at the figures in order to understand the situation much better. Let me give you this figure. In 2002, 34.7 trillion was the world economy, and the China was making $1.48 trillion of that, out of that 34. So we're talking about 4.3%. Why are we benchmarking with 2002? Because there was the SARS crisis in 2002, the production stopped, and back then China had a 4.3% share. And there is the, if you are to look at the situation right now, we're talking about $86.6 trillion of the world economy, and China's share is $14.2 trillion. So we can see that China has a very big share, 16.4%. So it has an important role to play. And out of a picture, when you take an important ring out of the chain, or even at a very small hurdle, you could see very significant implications of that. In the first quarter, the production stopped, which led to significant obstacles. It was not possible from Europe to get the orders, and we are talking about $300 billion of loss in services sector. But right now, for instance, in the second quarter, China started production. Well, because the situation is right now changing in China. However, Europe is right now canceling the demands from China. So this is again having implications, very bad implications upon economy. China is the first export market for 56 countries, and it is the first, it ranks first in terms of import for 64 countries. So as you can see, we are not able to dispute even the important role of China. We are talking about $2.6 trillion of export and $2.2 trillion of import in China. So this country is not just producing, it is also consuming. So the problem here is not just due to this crisis. Well, if we are to look at the last 5 to 10 years, the outlook of China, we have been going through some obstacles in China because there was a priority given towards branding, and this different economic model is being followed. And right after that, we also saw that trade wars began between the USA and China, which also added on the volatile environment and also vulnerabilities of China. Well, of course, this outbreak is going to have important implications when it comes to the vulnerabilities. There has been an 80% shrink in automotive sector. We are talking about $300 billion of loss in services sector, and in the production chains such as electronics, for instance, where you do not have stocks ready, we're talking about 19 to 17% of interactions between China and the other countries. So all these figures are giving a hard time to China. We are not talking about interaction of economic packages in China as it has been the case in the USA or in Turkey, because some precautions have been taken, yes, but it was at state level. Liquidity was provided to the central bank, which was actually taken up to $117 billion, and there was also an interest rate decrease. In addition to that, there were several investments which were classified as medium and small scale, which actually led to a decrease in the wages, and there was also a reduction in some of the taxes. I suppose this is going to be a shorter run, so I have to wrap up. I can say that there's going to be a new world order. The order is going to be changed, and there's going to be, well, I suppose it is too early to say that, because when there's going to be this vaccine which is found and the relevant treatment is being provided, we're going to have a normalized life. So it is too early to say that everything is going to be changing, we're going to have a new world order, etc. But of course, there are some things we need to take into consideration very seriously. First, all countries have to think about all those measures and lessons to take in under their own domestic conditions. Some measures should be strengthened, and maybe it is, of course, going to be much better for the countries to prevent external problems impacting the conditions within the country. I have seen this, for instance, in health sector. We have been able to achieve this in health sector. In the health sector in Turkey is doing very good, and it is not being impacted by the external situation from the other countries. We can see that the healthcare sector of Turkey has been very resilient. Of course, there's going to be also social state model, which is going to be outweighing the other types of models. But of course, the most sensitive one is going to be the impact upon the European Union. If you have any other questions, I'll be happy to answer. Okay, right now, where you're leaving, thank you very much. I would like to go back to Mr. Murat, Salim, Esenli, the European Union is of course very important. In France, in Italy, in Spain, we saw the European Union flags were taken away. Maybe after Brexit, there is this vague future of the European Union, and which was made even more ambiguous by the recent developments due to the outbreak. What is going to be the future of the EU? Well, let me say the following first. If you are to look at the last 4 years in the European Union, the European Union has not been able to pass the tests in a successful manner. The first test was, of course, the migration. As you know, there is this 18th March agreement between Turkey and the EU, and there the promises are not kept by the EU. Italy, for instance, has been left out by the EU, well, left alone by the EU. This is the feeling in Italy. We can say that today still is the same picture stays. Between the north and the south, we see a clear distinction, especially countries such as Germany, Austria, have been more protective when it comes to their own measures. So they were not taking measures at the European level, but rather than that, they have been taking measures at the European level. Well, of course, there is a logic behind this. If you are to look at the southern countries, which are being more impacted by this, they have to provide financial aid to several sectors, because if they do act differently, if they do provide several different approaches to different sectors, and of course this will lead to different results. Well, there is this mutual dependency which we call as being global. So at what is the scale? What is the degree of being global right now? We have been able to see this, and what is going to be the response to this? Is it going to be comprehensiveness? It is going to be inclusiveness? Is it going to be international relations, or being conservative when you are trying to respond to this crisis? As Abdulkadir mentioned, it is of course very early to say what is going to happen in the upcoming future. However, the longer the crisis stays, the larger the impact will be, of course, upon all the countries. My observation is as follows. Italy has been carrying out an important national fight against COVID-19, and since the day I started working in Italy, the popularity was around, for instance, 36% when it comes to the EU. However, if you are to ask the same question today, we can talk about 30% of a popularity by the European Union. The pace of the decisions taken in Brussels, we're going to see that in the upcoming period, of course. The time will show. However, as it is delayed, the trust is also undermined among people against the EU, and of course this is going to be shaping the picture that we will be seeing in the upcoming period. I'd like to share a few numbers with you. First one is about the producers. There is actually a board of producers as called as Confused, and it is like TÜSİAD in Turkey. It is a board by the businessmen and craftsmen. They stopped the production in the northern part of the country, which created a loss of 100 billion euros. It is not possible for Italy to handle this, so that is why there is great need to the funds coming from the EU. We are talking about 51% of a loss in Milano Stock Exchange. We are talking about billions, not millions anymore, of loss. And when it comes to GDP, well, the debt is quite high. We're talking about 134% of debt when compared to GDP. So the bond interests, for instance, has been increasing up to 250 points. So all these figures are clear indicators of the difficult situation that Italy is right now in. This being the case, Italy expects the EU to be more understanding, to be more helpful. However, we're going to see if this is going to be the case in the upcoming future. What I'm trying to say is as follows. These kinds of experience, well, taking into consideration the experience of Turkey, taking into consideration of other countries, well, these kinds of unities, this situation, this boards are all the time established under favorable conditions, so they're not prepared against such difficult times. So in such crisis times, in this time of an outbreak, of course, we can see that there's great danger for the future of not only that country, but also the humanity. Thank you very much. I would like to go back to Mr. Ersin. Well, South Korea is an important chain within the production line. So what kind of developments do you expect?
As you mentioned, South Korea has many factories locating in many countries, but the fact that they're locked down actually caused a very big break in a chain of supply, and they show very serious crisis symptoms as well. Academics and experts are trying to understand what is going on, and they are also trying to inform the public opinion about that, and they also give some information and share their ideas about the new world order when the breakout ends. And when will the pandemic end? Is it the end of globalization? Will China be replaced by the States? And will European Union close its doors? I believe these are important questions which are asked. I believe the COVID-19, when it's taken under control, normalization process will start. I don't believe that it will be terminated in a very short while. Just it will be taken under control, and the economic relations will get started. And some European countries, start normalization process nowadays. Otherwise, we can confront with an economic crisis which cannot be manageable, which cannot be handled. Okay, I believe there will be two economic crises after this pandemic. I believe the groups who are against globalization will have much more power. There have been trade wars after Brexit process. Some countries reinforced this process, and this was important milestone, and such attitudes will increase. Maybe this is one observation I have. And secondly, nationalist movements can be strengthened. The spread rate of COVID-19 will slow down, so they are also globalized. Such viruses normally do not recognize any boundaries, any national boundaries, but and it's important requirement. It brings important obligation to the countries to have international cooperations, to empower their cooperations, early warning systems, transparency guidelines, share of information and knowledge. All these pillars play a vital role in preventing such international crisis. So Against any international virus, you cannot resist alone and individually. So 169 countries are now trying to do their best to fight against this international virus. Globalization issue, globalization issue lead some countries to be dependent on others, especially in supplying medicine and medical stuff. Many countries, I believe, will concentrate on the domestic production more. There is no other way, so we have to find new ways, I believe, and G20 meeting will be held in Saudi Arabia this year, hopefully, with the participation of all leaders. So the global healthcare and the measures and actions which will be taken in healthcare systems will be taken up very likely, and how we can prevent such crises. What ways should be followed up to prevent spread of such a virus? These will be the important issues and the important decisions will be taken. What about the European Union? Will what will happen to European Union? Okay, the fact that the European Union did not support help Italy so much may bring serious question marks about the future of European Union. But I don't mean, or I don't interpret in a way that the European Union will be broken up. I don't think so. I believe it was an important experience, important indicator that they had some missing, some shortcomings in their cooperations. Maybe they should recheck themselves. They should maybe they should rethink about some shortcomings they have. A new world order will emerge. This is also conspiracy. I don't think this is realistic. Some process will slow down. Some new things may emerge, but this is not the matter of creation of a new world order. And the racism issue, nationalism issue, the Chinese, for example, were not allowed to some restaurants. And the South Korean people living in the United States complain that they are assumed they are Chinese and that they are imposed some violence. Unfortunately, such racism and nationalism movements may also increase. So anti-immigrants movements should be prevented. This could be hazardous, a dangerous movement. We are not talking about withdrawal from globalization, but we should recheck and rethink about some measures and actions which would be much more fruitful for our common future. Okay, thank you. Okay, on the one hand, we are trying to have some projections and estimations about what will happen, and on the other hand, the international community should think what mistakes have been made. I give the floor to Professor Fahrettin Altun to the floor again. The floor is yours, sir. Could you switch on the mic? Okay. I would like to thank all ambassadors a lot. all observations, all comments you shared with us are so precious because you have put important emphasis on the experiences and important factors you have been experiencing in the countries where you are. I've taken notes about your words. Okay, on the one hand, we are working on taking the control, the effect of the infection, effect of COVID-19, and the healthcare staff actually extremely working and spending huge effort on that issue, and we highly appreciate, and we are so grateful to them. And our president also emphasized the importance of the protection of the public order and the functionally operation of the healthcare system, food chain, social distancing. These are four important pillars, and our government spent huge effort for that, for these four pillars to be maintained, and these are important factors for the epidemic, for the outbreak to be taken under control. On the one hand, it's very important to keep our economy strong, to operate all these things, all the relevant factors alive, let's say. What we have experienced brings the importance of being a strong social state. While making policies, on the one hand, we have to consider the social state understanding, and on the other hand, we have to consider the individual personal freedoms. We have always focused on the personal freedoms as well. Our president has a very strong understanding and giving a very strong emphasis on that. Why do we need a strong, powerful Turkey, powerful social state? What we have experienced brought the need in a very clear manner. We made a very huge reform in our healthcare system with the city hospitals. And the healthcare system provides very valuable, free of charge services to our people. And the world is bigger than five, which is uttered by our president, and this is also very important. And from now on, we understand why the world is bigger than five. So one side, monolateral understanding cannot survive, and if you cannot fight against such a huge problem alone, so you need different stakeholders, you need different actors, you have to cooperate with all. I just want to reiterate that our president has managed this process since the beginning, and he is still actively in charge, and the very effective coordination and cooperation are conducted among the relevant institutions. It's very important indicator for our citizens as well. I just want to reiterate that our president is in charge very actively and very efficiently, and I wish we will get rid of this outbreak, and a very good future will expect us. I would like to thank all of you for your participation. It was very fruitful. Thank you so much. In presence of yours, I give my best regards to our citizens in in the countries where you are now. Thank you so much. Yes, thank you. We very strongly support this hope, and we would like to thank the audience as well. They asked many questions to us. It was not possible to answer all questions, of course, but we tried to do our best, and we collected the questions, and we've just wrapped up. I wish you healthy and successful work and day. To our ambassadors, I hope we will come together physically in a healthy days, and we will keep working on the agenda of our country. We'd like to thank the Directorate of Communications for giving this opportunity to us, and very valuable Director of Communications, Fahrettin Altun. We'd like to thank you for your participation, for your opening and closing remarks. Thank you so much. Have a nice and healthy day.